Hi everyone, this is Olivia with Brighter Connections Counseling, and today I wanted to share with you the progress chart that I use when working with folks in therapy. So I find that having a progress chart and tracking progress is a really important part of working through therapy for a lot of reasons, not just for the folks that are in therapy, but also for the therapist as well. One of those reasons is because I think we've all had similar experiences, either being in therapy ourselves or being the therapist, where you're just moving through life. Things can change quickly, things can change slowly, and before you know it, it's like, wait, what are we working on again? Like, what were we focusing on? Or like, wait a minute, we've been talking about this, but we started out with this, and now we're working on this, and I'm not sure if that's still relevant. And so this is kind of a way to provide some structure, provide some clarity, to set intentions, and to provide some direction as you're going through the therapy process. It's also really useful to be able to look back and see, oh yeah, I said that. I can't believe that was how I was feeling 3 months ago. I totally forgot. I'm actually doing a lot better now. And so it's nice to be able to look back on something, notes that you may have written months ago, and to be able to see progress. It's also nice to be able to check in and have something built into the process where you can check in together and say, like, actually, I know I started out with this intention, but I'm actually starting to feel more like this is the thing that I want to work on. And so it gives you opportunity to work on that, to communicate about that together, and to be on the same page. So there's a lot of great benefits to using a progress chart or some type of goal setting tool. This is the one that I use. I have a separate one for youth that I will upload a video at some point and share that also. But this one I will use for usually adults or even older teens. So here's the progress page itself, or the progress chart page. So what I'll do here with this page is I want to encourage the client to think about what is a desired outcome for their time in therapy. And so we'll write it here where it says goal 1. So what would they like to see? What would they like to have happen as a result of their time in therapy? And I usually use a PDF editor, or I will upload, if you have like a video software program that allows you to upload a PDF into your, like a whiteboard or something, through Simple Practice or another EHR, where you can type directly on screen or have the client type directly on screen. That's also a really great option. Sometimes I'll upload this as a PDF as in the whiteboard, or I'll use my PDF editor. Or if the client has a PDF editor, they are also welcome to share their screen and type. But it's a very collaborative process. One of us will be typing on the screen or both. So the goal, so what they would like to have as a result, what they'd like to see as a result of their time in therapy. Usually we'll start out with one goal. Let's just say for this example, we're starting out with one goal, and if, maybe months later we might add a second goal. I'll talk a little bit more about that in a minute. Or you might start out with 2 goals. I know sometimes people will have 2 specific things that they're working on. So we'll say we'll start out with one goal, and I will just use the client's direct words. Whatever they say, I'll put it in. I'll quote it. I might not put quotation marks in the text field, but I'll write what they say. So if it's like, I want to love myself more, maybe learn more or accept more about myself, accept myself more, something like that. Sometimes we just have to start somewhere. Maybe we might not know exactly what we want starting out, and that's totally fine. So if it's maybe just more of an abstract kind of thing, I'll go with that. I'll work with that. And we also get a chance to define what things look like a little bit further. So this is where we have more specific kind of behavioral definitions that might come out, emotional definitions for what this goal is and isn't. So we'll get a chance to talk about so what does it look like when things are really not going well for you, when things are down here at a 0, maybe at your lowest point? What sort of things do you tend to do? How does it feel in your body? How does it feel emotionally? How does it show up for you behaviorally? So, it could be like I have really negative self-talk. Might even be very specific about that. What is some of the narrative that plays in your head? Well, I say things like, I'm stupid, etc. So we'll try to go as much detail as I can, and we'll talk about that. So I'm not taking care of myself, I'm not eating well, I'm not sleeping well, I'm overextending for other people, I prioritize other people's needs over my own. And how does that show up for you? Well, I lend people money, or I do things on their behalf, even if they don't ask me to, I'll volunteer it. Or if they ask me, I have a hard time saying no. How is that feeling for you? How does that show up emotionally? I feel trapped, I feel exhausted, I feel resentful. So we'll be typing all of those things into this what 0 looks and feels like. And so then after that has been fully explored, that 0, and is feeling complete for the moment, we'll go over here to what a 10 looks and feels like. And I also tell folks, like, if something else comes up later, we can absolutely come back here and add to it. I give them a copy of this, and it's like, if you are reviewing it later, or if you want to just type something in there later, feel free to keep exploring that as things come up. It doesn't have to be like, this is the one chance, and then we'll never get a chance to change it. So 10 looks and feels like, so we get a chance to shift gears a little bit and do a bit of visualization. And this is a fun one. It can be a tricky one as well, because we're imagining something that doesn't exist. Whereas 0 is like, this is sometimes my present reality, what 0 looks like and feels like. But 10 is something that in many cases I've never experienced, and I'm not even sure exactly what that means. So it's a chance for us to create create some concrete elements to something that is very abstract. So let's just visualize a little bit. What is it? What can you imagine it feeling like to love and really love and accept yourself? Maybe bring up an image of that in your mind, of someone else, even of someone else loving and accepting themselves, maybe that you've witnessed or seen or read about. So we'll explore what that feels like. Maybe it feels expansive, it feels warm, it feels like not pressed, I'm not hurried, I'm not in a rush, I can just be. It feels like a release, it feels like connection. And how would that look for you, do you think, to be at a 10, where it's like, yes, I'm doing it, I'm embodying this, I'm living it out. Or it could be, I'm able to set boundaries, I'm able to release things that don't belong to me. How would that show up behaviorally? Like, maybe I'm taking care of myself, I'm setting aside time for myself, I'm protecting time with myself, I'm engaging in hobbies and things that I enjoy, that sort of thing. So we'll really get a chance to visualize, and this can a lot of times be a really emotional experience too, where it's like, it starts to become more real. Like this, I can actually start to see what this might feel and look like for me. So then, after we have defined what 10 feels like, myself, let me type in here, more connected to myself. Then we'll move up to this part here. So we'll say, okay, so today, for now, as we're starting out, let's think about where you are on this scale between 0 and 10, which we have already defined. So let's say, I'll put the date here. Say it's March 20. I might put like the year at the top. or something, but I usually just do the month and the day. And I'll check in typically every 3 months. So I'll have the date here, and let me grab, whoops, gonna grab my cursor. It's blocked by the, it's blocked. There we go. There we go. Okay. So let's say the person says, right now I am probably at about like a 2.5. So if they say a 2, I'll put the little check mark right there. And we might process this experience. What was it like to put a number to things, because sometimes that can be really challenging. So we'll process that experience, and we'll plan to check in again in a few months, and move this back and see where they're at. Now, I have another page down here that I usually like to do in the first session or two, where we're outlining treatment plans. So we've got objectives. We'll talk about the steps towards the goal. So we have the goal. What steps are we going to take towards the goal? So usually I will ask, I'll phrase it to people in this way, where it's like, are there any things, any areas where you sometimes think to yourself, if I could just work on this, I know that will really help me towards the goal. Or if it's like, if I can address these areas, I know that will really bring me closer to that goal. And more often than not, I find that people do have some thoughts around this, where with our previous goal example, it might, other things came up while we were talking, like setting boundaries, like taking on emotional burdens for other people, negative talk with myself. And so those are all good things to bring into this objective space. So you might think for objectives, okay, so we're going to address negative self-talk. We're going to address setting boundaries and assertiveness. There might be a trauma history that a person has, so we might want to process past experiences, and so forth. So whatever has come up so far in your discussion around the goal, those are really good pieces to pull into the objective. Something that makes it specific, where it's like, these are some specific areas that we're looking at, that as we're working on these, they're going to bring us closer to seeing progress in that goal. Next, we'll want to talk a bit about interventions. So this is in terms of things that we'll be doing. So things that we'll be doing together, maybe some things that I will be doing as a therapist, and there might even be some things that the client wants to bring forth and be like, okay, this is something that I'm going to be doing. I'm going to be reflecting on my daily routine, and I'm going to be thinking about hobbies. I'm going to be trying out new things. I'm going to be challenge myself to be open to stepping outside of my comfort zone, that sort of thing. So if they have some things they want to assert as things that they'll be doing, I'll add that in here. Things that I'll be doing, or I will be facilitating, or space that I will be providing in our therapy. Could be maybe we might do some emotion mapping. Maybe we'll do some expressive art. So I might put in here, and I'll tie it to an objective. So maybe for we'll processing past experiences through expressive art, and maybe doing like a life narrative. And then we might say, we'll address negative self-talk. We might do some ACT approach, depending on whatever your therapeutic model is. Maybe you use ACT or CBT or whatever, and they might do some thought diffusion or something around, depends on what your approach is, your therapeutic approach around that. So some specific things that you will be doing that you're like, okay, I'd like us to try to address this. Let's try using this strategy. I think could be really helpful. How do you feel about that? It gives the client a chance to be like, okay, yeah, that sounds good, or actually, I'd like to process this through art, and I'd like to try, such and such. So it gives you a chance to really collaborate on that. We'll talk about frequency, how often you'll meet, and how often you'll check in with the progress chart. And then I have another page here so that when you do check in, you get a chance to discuss what are the barriers, so what might still be standing in the way, which can be really helpful. Even if things are going really well and they have, next time you check in, they might be up here where it's like, oh my goodness, actually, yeah, things are improving. That's wonderful. So we can celebrate that. What progress, what success are you seeing? What changes are you noticing? And also, like, what are some areas that are still standing out from you? What are some things that are still sticking? Like, what are some points where you feel like, yeah, if we could address this or continue to address this, I think that's really needed, or that would really help. So it also provides the opportunity to make sure that your continued work is still relevant, is still on track, is still really resonating with the client. And then, of course, any space for other notes where it's like, oh, I'd noticed that this is coming up for me a lot. Or I'm noticing, if there's any patterns or trends that are coming up in your discussion of their progress, you can add here for notes. So this is my progress chart. This is one that I use with everyone that I work with. And it's also an interesting way to kind of track data in a way for myself, so that I know I can have an idea that people that I work with tend to make progress within this amount of time of starting therapy. They tend to make this much progress within this amount of time, and so it's helpful for me just as a provider to look at sort of everything as a whole. And it's also helpful, of course, to make sure that services are relevant and meaningful for the client. It provides opportunities for conversation and discussion of their progress and their treatment and their work with therapy. And if things, if there's a case where a person is not making progress and things are really difficult, that might also be a really helpful way to bring up conversation around, hey, maybe this isn't working for you, or maybe we need to try a different approach, or maybe it's not a good fit. And so there can be conversation around that too, where it's not like, it's more explicit, it's more like out there visually, instead of like, I just have this nagging feeling that I'm not making progress and I'm not really feeling good about it. Now it's more in the open. It's open for conversation. That conversation is encouraged, and we can both see that progress has not been consistent. So I hope you enjoy this progress chart. Even if you don't use this exact one, maybe this can help spur some inspiration around using progress charts, or checking for progress as part of your therapy process.